as to give you all the must-read topics. Clear? So with the help of this session, we'll be discussing all the important. Yes, beta, is audio video fine? Can we start with the session? Yes, good evening, very good evening. Is audio video fine? Thanks for all the compliment, even in the beginning of the session. Thanks, beta. Everyone, every student, can we start? Is audio video fine? That's great. So, beta, I will be giving you all the must-read topics, all the important points for the upcoming examination, and in the last spell, all my students preparing for the next examination, take my word, till 12th, we will work 24/7 and we will focus on revision, beta. हम लाइफ का सबसे बढ़िया गेम खेलेंगे on this upcoming 12th beta. We will be trying our best to give our best performance. सबसे बढ़िया performance देंगे. Try to crack this examination and we'll be starting the new journey of PG preparation. This should be the target. So everyone, I want thumbs up in the chat box. Every student listening to me, work 24/7 beta. This mantra for upcoming days, work 24/7. We will work hard and crack this upcoming examination. Let's start. CSF rhinorrhea, very important topic बेटा. Facial fracture आना ही आना है. यहाँ तो skull trauma और facial trauma MCQ mandatory. In skull fracture, they will ask you longitudinal fracture, transverse fracture. So I'm just making a important classification for you. बेटा fractures. In case of fractures, the classification will be either it will be facial fracture or it can be skull fracture. Skull fracture will be divided into longitudinal fracture, transverse fracture. I'm confident everybody must have revised all the important difference between the longitudinal and transverse. Longitudinal, conductive deafness, tympanic membrane perforation, blood in the external auditory canal, CSF in the middle ear. All these are the feature of your longitudinal fracture. Clear? Transverse fracture, you will be having sensory neural deafness. They are very less common. That is only in 20% of the cases. Vestibular symptoms, they are common in transverse fracture. So difference in longitudinal and transverse should be on your tips beta. In next 60 minutes, we are touching the must read topic beta. ये topic miss नहीं होने चाहिए आपको. I'm confident. Longitudinal transverse fracture should be on your tips. Facial fracture, they can either ask you CSF rhinorrhea. High probability they will repeat the same MCQ. They will give you a history of CSF rhinorrhea and which of the following is not done. So you tell me, treatment of CSF rhinorrhea is wait and watch. I cannot go for immediate surgical treatment. With endoscopy, not at all. Endoscopy is the most common cause beta. So हम दो बातें याद रखेंगे everyone. Most common cause of CSF rhinorrhea is equal to endoscopic trauma. Point 1. Clear? Most common site is cribriform plate. If it is traumatic, so there will be double ring sign. आज से 5 years back, they used to ask you double ring sign, halo sign. अब नहीं पूछते. अब आपसे क्या पूछते हैं? Treatment part or most common cause. Is it clear? There can be catch in the MCQ in your upcoming examination. They will give you a typical history of CSF rhinorrhea and they will ask you investigation of choice. Everybody should reply in the chat box. If they ask you investigation of choice for site of leakage, बेटा अगर साइट ऑफ लीकेज की बात आएगी तो हम किसको टिक कर देंगे? HRCT को. गलती नहीं करना बेटा. ऑल माय स्टूडेंट्स बिल्कुल इस पॉइंट को गलती नहीं करनी. Investigation of choice for site of leakage, HRCT. Investigation of choice for CSF rhinorrhea. Electrophoresis याद रहेगा बेटा. Electrophoresis will get beta 2 transferrin. Dr. Sneha, excellent. The first best reply, HRCT site of leakage, CSF rhinorrhea, electrophoresis. ये बातें याद रहेंगी बेटा. चलो 5 पॉइंट याद कर लेते हैं. Most common site, cribriform plate. Most common cause, endoscopic trauma. Treatment, wait and watch with IV antibiotics. No surgery, not immediate. If patient not responding, that's a different scenario. Investigation of choice for site of leakage is equal to HRCT and overall electrophoresis. Again beta, one day before the examination, CSF rhinorrhea is equal to cribriform plate, is equal to endoscopic trauma, is equal to wait and watch, is equal to HRCT, is equal to electrophoresis. ये काम की बातें याद करनी है. Am I understandable? Clear? Coming to the next slide, this is something I am showing you the trauma. This part, this is high probability because this was a NEET MCQ. Last NEET can be repeated in your upcoming FMGE examination. So just remember, if they ask you this fracture, what is this one? This is Jarjaway fracture. Everybody knows this one, Jarjaway fracture. They can ask you Jarjaway, or they can ask you Chevalate fracture. They can ask you Chevalate fracture. Jarjaway fracture, Chevalate fracture. Is it clear? This is known as horizontal fracture. This is known as vertical fracture. Vertical fracture. Is it clear? Crystal clear. Coming back to the next classification, Lee-Fort classification. They can ask you something on Lee-Fort beta. Lee-Fort 1, Lee-Fort 2, Lee-Fort 3. Lee-Fort 1 is low maxillary fracture. यहाँ पे हम याद रखेंगे, it is known as low maxillary because it is below the maxilla. Because it is below the maxilla, so there is a trauma on the palate. क्या कहते हैं बेटा? Trauma on the palate, floating palate. So you are having floating palate. You are having one sign. Which sign? My intuition say they can ask you either Battle sign or Gurin sign. बेटा बैटल साइन होता है स्कल फ्रैक्चर, इकाइमोसिस ओवर द मेस्टॉइड. हियर इज Gurin sign, ecchymosis over the palate. That's it. Very simple. If they ask you something about Lee-Fort 2, what is Lee-Fort 2 known as? We call it as pyramidal fracture. Lee-Fort 2 का नाम बेटा pyramidal. Lee-Fort 3 known as craniofacial. Cranium separated from the face. Craniofacial disjunction. Craniofacial disjunction. याद रखेंगे बेटा, craniofacial disjunction. Clear? So बेटा MCQ number 1, we have touched all the important topics: longitudinal fracture, transverse fracture, difference between these two, difference between Lee-Fort 1, 2, 3, Chevalate and Jarjaway. High probability they will pick MCQ from this segment. Clear? So these are the important points. Trauma minimum 1, max 2 MCQ will be there in your ENT segment. Clear बेटा? ये यहाँ तक समझ में आ रही बातें? Very simple, straightforward. That's great. Everybody is responding. Coming to the next one. On the day of delivery, a newborn is undergoing a screening. Newborn. High risk word is not there, beta. अगर high risk होता, if it is a high risk baby, meningitis, CNS involvement, we will be going for beta. Clear? But here they have not mentioned the high risk baby. तो हम क्या कौन सा build up करेंगे? Investigation of choice, otoacoustic emission. Otoacoustic emission is by outer hair cell. याद रखेंगे बेटा, outer hair cell. Otoacoustic emission is a screening procedure. Is it clear? Now, can I give you one more MCQ? Among the 4 choices, same choices beta. Let us change the MCQ. Which of the following is not a objective investigation? Which of the following is not a objective? Can you tell me which of the following is a subjective investigation? Pure tone audiometry is a subjective investigation beta. Clear? Now, which MCQ answer will be tympanometry? Tympanometry is an investigation of choice for conductive deafness. Investigation of choice for neural deafness is equal to beta. Now listen carefully beta, listen carefully. एक MCQ इंपॉर्टेंट है, एक मार्क्स इंपॉर्टेंट है. आप वैल्यू ऑफ मार्क्स उन बच्चों से पूछो जो बेटा बिटवीन 145 एंड 150 दे स्टक एंड दे रिग्रेट के यार ये 2-3 मार्क्स ज्यादा आते तो आई विल बी ऑन द अदर साइड ऑफ द गेम. So just try to crack बेटा, just try to focus on each and every MCQ. एक क्वेश्चन आपके लिए इंपॉर्टेंट है. आप समझ रहे मेरी बात को? तो एवरीवन लिसन केयरफुली बेटा, एक एक वर्ड इंपॉर्टेंट है. ऑटो अकॉस्टिक एमिशन, न्यूबॉर्न. इफ दे हैव मेंशन हाई रिस्क बेबी, आई विल बी गोइंग फॉर पैरा. ये बात याद रहेगी. सब्जेक्टिव इन्वेस्टिगेशन, ऑब्जेक्टिव इन्वेस्टिगेशन, वेरी इंपॉर्टेंट, very important. Classification should be there. Subjective, which are the subjective beta? Pure tone audiometry. They can ask you speech audiometry. They can ask you tuning fork test. All they are here. Subjective investigation. Objective, which are the objective? 3 objectives. So let us make a concept beta. Investigation of choice. अगर आपसे पूछेंगे conductive deafness, investigation of choice is impedance audiometry. याद रखेंगे, impedance audiometry. रिवाइज विद मी बेटा, इस सेशन में हम काफी कॉन्सेप्ट्स रिवाइज करेंगे. impedance audiometry. सेंसरी डेफनेस याद करो बेटा मेरे साथ. इलेक्ट्रोकॉक्युलोग्राफी इज द इन्वेस्टिगेशन ऑफ चॉइस. व्हाट इज द स्क्रीनिंग प्रोसीजर? स्क्रीनिंग इज OAE. दे कैन आस्क यू ऑटो अकॉस्टिक एमिशन गिव यू द स्टेटस ऑफ, you tell me, auto acoustic emission give you the status of cochlea. Which part of the cochlea? Outer hair cell of the cochlea. Is it clear? Absolutely clear. Neural deafness, investigation of choice will be BARA, brainstem evoke response audiometry. अब बेटा ध्यान से सुनेंगे, प्रॉब्लम कहाँ आती है? When you are not confident of synonyms, आपको उसके दूसरे नाम नहीं पता. Like last examination they have asked you which bacteria is responsible for necrotizing otitis externa. So very few students they are confident that necrotizing otitis externa is the other word for malignant otitis externa. Are you getting the question? MCQ. BARA. Instead of BARA, they will write the word ABR. तो बेटा आपने confused नहीं होना. What is ABR? Auditory brainstem response. बेटा speak out with me in the class only. Brainstem evoke response audiometry and auditory brainstem response. तो एक ही बात है ना. तो it is a neural deafness. Is it clear बेटा? Is this concept clear? Conductive deafness, impedance audiometry. Sensory deafness, electrocochleography. Autoacoustic emission screening. These concepts should be clear. Neural BARA, यहाँ तक समझ में आ रहा है बेटा? क्लासिफिकेशन समझ में आ रही है? प्योर टोन ऑडियोमेट्री, वेरी इंपॉर्टेंट. Expect बेटा minimum 1, max 2 MCQ from only one single topic, pure tone audiometry, and we will revise the whole pure tone audiometry in 1 minute. Beta, everyone concentrate on the board. This is my x-axis. Is for hertz, y-axis for decibel. What is the cutoff marking? Cutoff threshold is 25 decibel. आ रहा समझ में बेटा? In the last spell, अब हमने concepts and everything will not go beyond in each and every point in depth, not at all बेटा. Last spell, revise in a fast mode. Air conduction graph, bone conduction graph. मैं लिखता जाऊंगा बेटा, आप लोग reply करेंगे. Everybody should reply in the chat box. Both the graph, air conduction graph, bone conduction graph, they are within 25. They are within normal. Means subject is normal बेटा. इस ग्राफ को अपने माइंड पे इम्प्रिंट करो. This is a normal graph. Clear? Now air conduction is beyond 25. BC is within 25. तो बेटा हम इसका क्या नाम रखेंगे? Call it as airborne gap. तो इसको इम्प्रिंट करो माइंड पे. It is conductive deafness. It is conductive. Again revise with me. Both the graph within 25 normal. One beyond, one within conductive. Both are beyond. Air conduction, bone conduction are beyond 25. We call it as sensory neural deafness beta. What we are doing, we are revising pure tone audiometry, sensory neural deafness. And now if examiner give you a graph in which both the AC, BC, air conduction, bone conduction, both are beyond and there is a airborne gap, what we call it as mixed deafness. Are you confident beta? Normal, conductive, sensory neural and mixed deafness. Is it clear? These graphs should be on your tips. Now, like in last examination, your examiner have given you 2 MCQs from pure tone audiometry. They have asked you Carhack notch, that is otosclerosis. One is low frequency hearing loss. They ask for Meniere's. तो बेटा हम 2 ग्राफ याद करते हैं. If the examiner give you rising curve, low frequencies are involved, 500 hertz is involved, it is Meniere's graph बेटा. इसको याद करते हैं, इसको कहते हैं Meniere's graph. Low frequency, क्या कहते हैं इसका नाम? Low frequency hearing loss. And if the graph is coming down sloping, this is known as Meniere's graph. This is known as presbycusis, high frequency hearing loss. High frequency hearing loss, presbycusis. One of the student is asking me to repeat. तो Rachit beta very simple है, air conduction, bone conduction both are normal, means all the compartment are normal. If air conduction is abnormal, means air conduction pathway is abnormal, means conductive deafness. And if AC pathway and BC pathway both are abnormal, it means my common destination is gone. That is your sensory deafness or neural deafness. That is very simple. You can listen to these concepts again, no worries. Now, which are the next two graphs? They can ask you at 2000 Hz. But a high probability they will ask you 4000 Hz. Last time they have asked you 2000 otosclerosis, 4000 noise induced trauma. They can ask you what is the maximum limit of sound in industry. WHO 85, Indian Factory Act 90. I hope everybody loving the session. We are revising all the concepts in a nice way. Is it clear? Very good. Yeah, that's great. Everybody is responding. The speed at which chat box is moving, this speed is required in the last spell beta. Clear? So what is OAE, autocaustic emission? We keep a electrode in front of pinna, is a non-invasive. AABR, again examiner is confusing you. What is AABR? हमने तो ABR पढ़ा था. This AABR is automated auditory brainstem response. Automated auditory brainstem response. Is it clear? Clear. Now learn my next formula. The next formula is impedance audiometry. Sorry. Impedance audiometry is made up of tympanometry. Plus stapedial reflux. बेटा रिवाइज करेंगे. Conductive deafness investigation of choice is impedance audiometry. Impedance audiometry is a combination of tympanometry with stapedial reflux. Beta. All these graphs should be on your tips. This is normal graph. This is known as flat tympanogram, also known as B tympanogram. Flat tympanogram, B tympanogram. Flat is seen in the fluid in the middle ear if there is extra fluid. B is seen in perforated tympanic membrane. Perforated tympanic membrane. Is it clear? Dr. Parth, beta, if you are stuck on 148, I will advise you to work hard on short subjects. Beta. Work hard on the short subject. It helps a lot. Short subjects with patho and pharma. These subjects helps a lot better. Please follow this religiously. Type C, everybody confident? This is ET tube dysfunction. ET tube dysfunction. ET tube dysfunction. If examiners show you this type of graph, it is AS graph. Otosclerosis, tympanosclerosis. And this is hypermobile AD graph. This is seen in ossicular damage. So these points should be on your tips better. Am I understandable? Very simple. No hi-fi things. Stapedial reflux, which is the highest center for stapedial reflux, इसको highlight करेंगे बेटा, superior olivary complex. So your examiner can confuse you by writing the word ipsilateral, contralateral. Just remember, ipsilateral, contralateral, both the highest center is your superior olivary complex. Superior olivary complex. Done. If examiners show you this investigation, बेटा इसका नाम याद करेंगे electrococulography. Yes, but B and flat are nearly same. They will not give both the option. Book says B is typically for perforation and flat is typically for fluid. Clear? This is a basic funda. This is a logic. Electrococulography is a invasive investigation. They can show you this image better. There is a motive behind this image. This is the only invasive. Therefore, examiner will show you this image and he will ask you, this is for which deafness? So be confident this is for, yes, everyone should tell me this is for sensory deafness. This is for sensory deafness. This is your BERA, BERA, brainstem evoked response audiometry. Largest wave is fifth wave. The auditory pathway ECOLIMA should be on your tips better. They can ask you the auditory pathway and all these points. Coming on the next MCQ. A 6-year-old boy coming to the hospital with sore throat. On examination, there is a swelling seen on the side of pharynx with the tonsil shifted to midline. तो बेटा हमने क्या कौन सा build up करना है? You tell me. All the four options are abscess. Let us rule out the option now, one by one. The students, everyone, just learn beta. This concept should be clear. Abscess. How to differentiate the abscess? Examiner is asking you in the side of pharynx, on the side. On the posterior wall, if examiner mention the word posterior pharyngeal wall, If examiner mention the word posterior pharyngeal wall, Dr. Omkar beta, it is not it is not peritonsillar abscess, not at all. If examiner mention posterior pharyngeal wall, MCQ is direct, that is retropharyngeal abscess. Clear? So can I take this opportunity beta to highlight the keyword in the MCQ? One keyword will help you to crack the MCQ. Posterior pharyngeal wall is equal to retropharyngeal abscess. Examiner mentioned the word woody swelling in a diabetic patient. तो बेटा किसको टिक कर देंगे? Ludwig abscess को टिक कर देंगे. Is it clear? This concept clear? Now, option A and option C, peritonsillar abscess, that is quinsy, or parapharyngeal abscess. What is common between these two? Common between option A and option C is lateral wall. They are in the lateral wall. They both push the tonsil to the midline. Now just remember this concept, beta. Infection like tonsillitis, it is bilateral. Both the tonsil will be inflamed. Both the tonsil will be coming to the midline. But abscess is unilateral. Very good, beta. Dr. Gaurav, excellent. How to differentiate peritonsillar abscess from parapharyngeal abscess? Peritonsillar abscess will push the tonsil to midline, but will be no external swelling, no external bulge will be there in the neck. Am I understandable? And in case of parapharyngeal abscess, which is the right answer in this MCQ, there will be neck swelling present. Very good. The student writing the formula, Dr. Gaurav, excellent. If the neck swelling is there, I will be going for parapharyngeal abscess. Is it clear, beta? Crystal clear? Now one more concept. Retropharyngeal abscess is extending up to bifurcation of trachea. Beta, very favorite question of your examiner. So what is the lower limit? Lower limit of retropharyngeal abscess is your bifurcation of trachea. And what is the lower limit of parapharyngeal abscess? Parapharyngeal abscess extend up to hyoid bone. It extend up to hyoid bone. These are the two concepts, beta. Done. One more MCQ they can ask you, where we give the incision. Retropharyngeal abscess, obviously it is behind posterior pharyngeal wall, so we will give the incision on the posterior surface of sternocleidomastoid. Beta, no rectification, not at all. Apply the logic. Parapharyngeal abscess, IND, incision on the anterior surface of sternocleidomastoid, retro on the posterior surface. Is it clear? Absolutely clear. So these are the few important concepts from where they can make the MCQ. क्लियर. क्वेश्चन नंबर 4 तो गलत करना ही नहीं है बेटा, ये तो रूल ऑफ द गेम आना ही आना है. और किसको टिक कर देंगे बेटा, आप बताओ. इमरजेंसी, patient having the dinner or lunch and patient start choking, I will directly jump on option A, Helmich maneuver. आना ही आना है बेटा. क्लियर. ये तो फेवरेट है ना, MCQ स्टार्ट ही इसी क्वेश्चन से होते हैं. तो ऑप्शन ए विल बी द राइट आंसर. कमिंग ऑन क्वेश्चन नंबर 5, साउथ इंडियन, यू आर ए डैम स्टूडेंट, तमिलनाडु मेंशन. हमने क्या सीखा था बेटा क्लास में? साउदर्न पार्ट ऑफ द कंट्री इज योर rhinosporiosis. Rhinoscleroma is a northern part. Lucknow, Ranchi, Patna. If these words, I will be going for rhinoscleroma. Here is a South Indian, Tamil Nadu. Rhinosporiosis, male, cattle breeder, coming from a complaint of intermittent epistaxis. Young boy with intermittent epistaxis. तो बेटा हम क्या क्लिक कर देंगे? We will click angiofibroma. Here is a middle-aged patient, South Indian male, coming with a complaint of intermittent epistaxis. But age is not mentioned, so till now we can't comment anything. On examination, the image examination of the finding is given. A biopsy is taken. Biopsy image is given to you. Nasal ear mass coming from the nose is not shown. It must be mulberry. What is the keyword for this MCQ? Mulberry-like polyps होंगे बेटा. या तो MCQ में mulberry-like polyps, or they will mention the word. This slide will be given rhinosporiosis. बड़े बड़े spores दिख रहे हैं ना बेटा, so we call it as rhinosporiosis. Am I understandable? Clear? Treatment of choice, we have to remove surgical excision. इस पे क्वेश्चन आता है बेटा. What is mandatory? Mandatory is cautery at the base. इस पे क्वेश्चन बनेगा बेटा, cautery at the base. Why? It is mulberry-like polyp. Because mulberry-like polyp, it bleed a lot. Because it bleed a lot, we have to do cautery at the base. Cautery at the base. Anybody who can write in the chat box, what is the drug of choice? आप बताओ बेटा. Drug of choice will be dapsone. Dapsone is used to reduce the chance of reoccurrence. So beta, everyone revise with me. Let's concept, like if they show you hypertrophy of sebaceous gland, we go for rhinophyma. What is rhinoscleroma? In rhinoscleroma, they will give you something Mikulicz cell or Russell bodies, or they will give you a keyword. Which keyword? Woody nose. If examiner mention the word woody nose, so beta हम उसको क्या click कर देंगे? Rhinoscleroma. And if examiner give a typical history of taking bath in the ponds south from Tamil Nadu, we will be going for rhinospodiosis. Rhinoscleroma is a foul smelling. Beta listen carefully. ध्यान से सुनेंगे. ये keyword will help you. Abscesses, bleeding, nasal obstruction. It is going in the favor of rhinospodiosis. Foul smelling crust with woody nose. This word, but I am having intuition this question will be there. If the woody nose is there, I will be going in the favor of rhinoscleroma. Clear? So MCQ will be either on rhinophyma, rhinoscleroma, or rhinospodiosis, or they may ask you both the MCQs. Coming to the next question, number 6. A 10-year-old child post tonsillectomy ate a packet of chips after 2 to 3 days. After 2 to 3 days means beta हमने क्या क्रॉस कर लिया? We have crossed the limit of 24 hours. If it is within 24 hours, the cause will be slippage of ligature, reactionary bleed. Clear? And now it is after 2 to 3 days, so it is secondary bleed. Anyone who can tell me what is the most common cause of secondary bleed? Most common cause of secondary bleed is infection, and because infection is the most common, I will be going for IV antibiotics. यहाँ पे आंसर क्या होगा बेटा? Here answer will be IV antibiotics. So answer will be option A in this MCQ. Is it clear? No hi-fi things. Is this concept clear, beta? We'll be going for option A, treatment. What is the treatment of primary hemorrhage that is on table? Is your injury to the vessel. We have to ligate. Clear? We have to ligate. If it is a primary hemorrhage, it is on table. Reaction is within 24 hours. If this is after 24 hours, we'll be going for here IV antibiotics. Is this concept clear? Which position? Rose position. Tonsillectomy. Indication of tonsillectomy, they can ask you something about Eagle syndrome. Yes, Eagle syndrome is a long styloid process, beta. When there is a long styloid process, we go for tonsillectomy. We want to go to the bed of the tonsil. So all those concepts should be clear. Adenoid faces, very important. Ana beta question on adenoid faces. Or they can ask you something about which membrane bleed, tonsillar membrane. I will discuss that MCQ in detail, no worries. So just remember, adenoid face is important, type of hemorrhage is very important, Rose position is important. Coming to the next one, a 30-year-old female with a history of ear discharge in the left ear with deep-seated pain. I am giving a nice mnemonic: discharge, deep-seated pain, diplopia. So beta किसकी बात चल रही है? We are talking about complication of unsafe ear. We are talking about complication of CSOM. Which complication? Petrous bone involvement. Is it clear, beta? Petrous bone involvement means it will be your Gradnigo syndrome. Clear? Which of the following? Or they can ask you what is the investigation of choice. If examiner asks you investigation of choice, this will be HRCT. Beta, दो concept built up करते हैं. Everyone stop writing. Listen, a nice concept. ENT, दो ट्राइड्स इंपॉर्टेंट है बेटा. या तो ट्रॉटर्स ट्राइड पूछेगा आपसे एग्जाम में, या ग्रेडनिगो ट्राइड. आने जाना है तो इसको लिख लेते हैं. लेट्स राइट दीज 2 पॉइंट्स. आइदर ही विल आस्क यू समथिंग ऑन ट्रॉटर्स ट्राइड और ही विल आस्क यू ऑन ग्रेडनिगो ट्राइड. ये दो इंपॉर्टेंट है ना बेटा. सबसे पहले निमोनिक बना लेते हैं. T for trotters, T for 10th nerve. So what is the difference between these two? Here it is 5th and 6th nerve involvement, and here is your 5th and 10th nerve involvement. Clear? Now 5th and 10th nerve trotter's tract is seen in, can I make a formula for you? It is seen in nasopharyngeal carcinoma, जहां से आपसे वो पूछेगा fossa of Rosenmuller. So आपके एग्जाम में इन योर अपकमिंग FMG एग्जाम either they will ask you on tortoise trap or they will ask you on the fossa of Rosenmuller. Or the last important point for this nasopharyngeal carcinoma treatment is radiotherapy, chemotherapy. Angiopharyngeal is surgery and nasopharyngeal carcinoma is radio plus chemo. इस concept को build up करना है. Vertigo tract is equal to 5th and 6th is equal to petrous bone involvement. एंड इफ पीटर्स बोन इन्वॉल्वमेंट तो हम क्या करेंगे HRCT. और नेसोफेंजियल कार्सिनोमा में इन्वेस्टिगेशन ऑफ चॉइस क्या होगी बेटा MRI. जस्ट रिमेंबर दीज टू कॉन्सेप्ट्स. ट्रॉटस ट्रैक रिवाइज विद मी बेटा, क्लास में रिवाइज करते हैं. ट्रॉटस ट्रैक व्हाट इज द इन्वेस्टिगेशन ऑफ चॉइस MRI. Vertigo tract investigation of choice HRCT. One for nasopharyngeal carcinoma, one for petrous bone involvement. Is it clear beta? Crystal clear concepts. Now concentrate on the board. Next level, next concept. Concentrate 1 second. Just give me 1 second. Coming to the next level. Just wait. Kindly update in the chat box beta. Is audio video everything fine? Kindly update. Yes. So let's go to the next level. Now concentrate on the board. We will crack all the important, yes, आप बताएंगे बेटा, all the other options. Will not jump to the next MCQ. In the last spell, whenever you are attempting the MCQ, focus on other options. Other options are very important beta. Other options. Yes, everyone. ग्रे सिंगर साइन. व्हाट इज ग्रे सिंगर साइन? आएगा बेटा इन 4 पॉइंट्स में से एक क्वेश्चन आना है. ग्रे सिंगर साइन. व्हाट इज ग्रे सिंगर साइन? Edema over the mastoid. The one smart student, what he will do, he will write Crowback sign. Either examiner ask you on Crowback sign or Gray Singer sign. So बेटा दोनों में कॉमन क्या है आप बताओ. Tortoise. One of the students is asking me. Dr. Neeraj is asking. Yes, tortoise के बारे में. Tortoise triad nasopharyngeal carcinoma. They will be 5th nerve and 10th nerve palsy बेटा. क्लियर. अब इस पे आते हैं ग्रे सिंगर साइन. इडीमा ओवर द mastoid. रिवाइज विद मी बेटा, ये इंपॉर्टेंट साइंस हैं. ENT they will be asking you what is Crowback sign. Crowback sign is edema over the retinal vein. Edema over the retinal vein होगा तो Crowback sign. Edema over the mastoid is your Gray Singer sign. Clear. Grissel syndrome we have already learned. Long stellar process. 1 MCQ over Grissel syndrome. Clear. Yeah. Slip of tongue. Grissel syndrome, C1, C2 subluxation. Eagle syndrome. If the examiner asks you about Eagle syndrome, that is long stallard. So don't confuse these two. Eagle syndrome, long stallard process. That is your indication for tonsillectomy. One important MCQ on Eagle syndrome. Everyone listen carefully beta. Eagle syndrome, they can ask you how the pain is going to the ear. 9th nerve. Revise with me. Eagle syndrome, long stallard process, 9th nerve. Here is a Grissel syndrome. What is Grissel syndrome? Very rare complication of adenoid surgery. Adenoid tonsillectomy, that C1, C2 subluxation. Am I understandable? और बेटा एक important point याद रखेंगे. They can ask you. It is commonly seen. Let's see who reply in the chat box. Grissel syndrome, that is atlantoaxial C1, C2 subluxation, is seen in anyone. Which kids? It is seen in those kids who are suffering from. I'm waiting for a response. Yes, very good, Dr. Shubham. I love your comment बेटा. That's great. 2 best friend के नाम याद करने हैं. Stallard and 9th nerve. That's great. You revise my notes religiously. 2 best friend, that is Stallard and 9th nerve. C1, C2 subluxation. I'm waiting for the response. Yes, this is seen in those kids who are suffering from Down syndrome. बेटा एक concept याद रखेंगे. अगर आपके MCQ में they are mentioning Down syndrome patient with tonsillitis, so which complication can be there? Grissel syndrome. That is C1, C2 subluxation. Is this clear? Coming to the next one, Hallman-Miller. ये तो favorite है ना? Hallman-Miller sign. Posterior wall of maxillary sinus bending down. किसमें लिखेगा? Hallman नाम में छुपा है, Hallman-Miller sign, it is seen in, yes, angiofibroma, posterior wall of maxillary sinus bending down. Is it clear? So they can ask you these important points. Coming on the complication part now, let's better CSOM, very important. Atticoantral treatment for, first of all, you should be confident if examiner asks you of tubotympanic ear, that is safe ear, treatment is tympanoplasty with OCR, ossicular chain reconstruction. If examiner give you unsafe, what is the other name of unsafe? We call it as atticoantral ear, treatment is MRM. बेटा पहले सबसे पहले let's make these two concepts. Tubotympanic ear. If examiner asks you tubotympanic ear, it is tympanoplasty with OCR, ossicular chain reconstruction. Atticoantral. If examiner asks you about atticoantral, it is MR, modified radical mastocytoid. Is this concept clear? Now, atticoantral have many complications. MCQ आना है. Therefore, I am wasting my time on this question. In these flowcharts, intracranial complication, extracranial. Revise कर लेते हैं बेटा fast. Intracranial, most common intracranial complication, meningitis. Second most common, brain abscess. Most common site of brain abscess, sir, temporal lobe. Is it clear? One complication intracranial is lateral sinus thrombophlebitis, जिसके हमने अभी साइन याद किए, Kresinger sign, Crobach sign. One, they can ask you in lateral sinus thrombophlebitis, empty delta sign भी पूछ सकते हैं आपसे, spiky fever होता है. So these are the points of lateral sinus thrombophlebitis. Extracranial, the important is mastocytosis. ये आएगा बेटा क्वेश्चन. Either they will ask you the most common extracranial, most common overall, or they can ask you which part of the facial nerve is involved in facial nerve palsy. तो बेटा आप क्या टिक करेंगे? You will attempt tympanic part. Or they can ask you something on petrous bone, which we have already discussed, that is Gradnigo triad. Clear? So intracranial, extracranial complication of CSOM, mandatory MCQ बेटा आना ही आना है. Clear? So these are the important points. Coming on the next one, 30-year-old female. Pregnant word will be there in the MCQ. We will be going in the favor of otosclerosis. Is it clear beta? Loss at 2000 hertz. That is your otosclerosis. Very important topic. Either they will ask you on otosclerosis or Meniere's or acoustic neuroma. In में से एक question आ रहा है. Clear? Auto, pregnant female, if mentioned, it is otosclerosis. Let us crack few keywords now. Now concentrate on the board. Which are the important MCQs on otosclerosis? Sir, 2000 hertz. One day before the examination, beta, we have to learn in this way. Otosclerosis 2000, Carhart notch. This Carhart notch is seen in bone conduction. It is seen in bone conduction. Is it clear? What is the key word for this MCQ? Is here pregnant female. Pregnant female. It is painless bilateral conductive deafness. So presentation should be on your tips. It is bilateral conductive deafness. Here they can ask you important point. They can give you history. Patient is feeling very comfortable in noisy surrounding. This is a hallmark feature of conductive deafness beta. What is a hallmark feature of conductive deafness? Patient are feeling comfortable in noisy surrounding. We call it as paracusis Wilson. Is it clear? Patient feeling uncomfortable. यहाँ पे ब्रैकेट में हम मेंशन करेंगे patient if. What is the opposite of this? The opposite of paracusis Wilson is patient is uncomfortable in noisy surrounding. If examiner mention uncomfort in noisy surrounding, we call it as Tullio's phenomena. So बेटा दो पॉइंट्स याद करेंगे. Paracusis Wilson, Otosclerosis बेटा Tullio phenomena, patient is uncomfortable in noisy surrounding. While paracusis Wilson, patient is very comfortable in noisy surrounding. This is the keyword. One more keyword they can give you, that is your voice of the patient. Conductive patient always have very low intensity, soft voice. Because when they speak, they get their own voice. No disturbance coming from outside. Done. On otosclerosis, they can ask you treatment of choice. So always remember, it is tapedotomy. better than stepidotomy is better than stapedectomy. Just remember this concept, beta. Stepidotomy is better than stapedectomy. If short sign, if examiner give you a short sign, what is short sign? Red tympanic membrane, also known as flamingo pink sign. If examiner show you, that is a contraindication of surgery. So हम क्या देंगे? We'll give a drug, sodium fluoride. Is it clear? So one day before the examination, otosclerosis, pregnant female, 2000 is equal to Carhart notch is equal to bone conduction. It is patient comfortable in noisy surroundings, soft voice, stepidotomy better than stapedectomy, short sign given, contraindication, we go for sodium fluoride. These are the keywords, beta. In the last spell, we have to work like this, beta. Last few days, we have to play the game like 2020. एक एक बॉल की इंपॉर्टेंस है, एक एक रन की इंपॉर्टेंस, एक एक मार्क्स की इंपॉर्टेंट है. एम अंडरस्टैंडेबल बेटा? यहाँ पे हमने गेम को लाइटली नहीं खेलना. एंड दो स्टूडेंट्स हु कुडंट प्रिपेयर for in the last 1 or 2 months because of any unavoidable circumstance, beta, at this point don't quit. Not at all. No, don't quit at this point. I'm just giving you one formula for those students who couldn't study in the last few days or weeks. Just follow, beta. We have one DFX, that is very fast revision program for FMG students, plus PYQs. Last days mein beta ye minimum hai. This is a minimum thing which we have to do. We can easily crack this screening exam. Very comfortably you can crack. Clear? So just don't quit at this point of time. Meniere's disease, second option given. What are the keywords? Achha, one more point. Which infection associated with otosclerosis? They can ask you measles. Measles associated with otosclerosis is again a potential MCQ. Clear? बेटा आपकी स्लाइड पे देख रहे हैं ना, आपको otosclerosis के आगे कुछ वर्ड्स देख रहे हैं. These are the only important points which they will highlight in the MCQs. Clear? Meniere's disease. Meniere's disease, what is the keyword? Fluctuating deafness, beta. याद रखेंगे, fluctuating deafness. Fluctuating deafness. Because there is a back pressure. The basic pathophysiology of Meniere's is there is a back pressure in the endolymphatic sac. Therefore, the symptoms are fluctuating deafness. Commonly seen in males of age 30 to 40. This is again important keywords. They will give you the word of Tullio's phenomena. This is again a feature of Meniere's because Meniere's is a sensory deafness. Because it is sensory deafness, what will be the investigation of choice? Electrocochleography is the investigation of choice for Meniere's. Just remember this point. M for Meniere's, M for medical treatment. Low salt diet, 80% of the patient respond with dietary modification. If patient is not responding, the flow chart should be on your tips, beta. If patient not responding to dietary modification, we'll go for physiotherapy. We'll be going for physiotherapy. Patient not going for physiotherapy, responding to physiotherapy. My 90-95% of the patient respond with low salt diet with physiotherapy. Not responding. Endolymphatic sac decompression. Patient not responding, we can go for destructive procedures like injection of gentamicin and all those points. So these, the management part, management of Meniere's is very important. They will ask you the MCQ. Done. Option C, noise induced hearing loss. Always remember, beta, WHO guideline, the loss will be at which decibel, which frequency, we have already learned. The loss will be at around 4000 hertz. WHO people say maximum limit in any industry, sound should not be more than 85 decibel. Sound should not be more than 85 decibel. But Indian Factory Act, what Indian Factory Act say, it can be 90 decibel. It can be 90 decibel is an important point. WHO 85, Indian Factory Act 90. They can ask you hours, number of the hours, 8 hours in a day, 5 days in a week. These are the important points which should be on your tips. But इसमें गलती मत करना. Your PSM people can ask you what is the maximum limit in a city life. If they ask you about city life, it is 45 decibel. If they ask you about city life, it is around 45 decibel. All these points we have discussed in the classes. Clear? Coming to the next one, a 50-year-old male Male with tinnitus, fluctuating hearing loss. Beta. The word keyword fluctuating with examiner is giving showing you rising curve will be going for Meniere's disease. So here answer will be your Meniere's disease. Clear? All the important all the four choices are the important options. Beta. Important options choices are the potential MCQ for your upcoming BPV. आना चाहिए बेटा. What is BPV? Very mild vertigo. Just highlight this point, beta. Vertigo for few seconds with no hearing loss. What is the investigation of choice? Hall-Pick maneuver. Treatment of choice, Appley's maneuver. Investigation of choice, Hall-Pick. Treatment, Appley's maneuver. Vestibular neuritis. Again, pediatric patients with a history of URTI, some viral infection. Now landing up in the vestibular neuritis. No hearing loss again in this patient. Noise-induced trauma. Already we have cracked this concept. So this answer is in this MCQ will be Meniere's disease. Here, Meniere's is a good example of sensory deafness. And if it is a sensory deafness, what is a hallmark feature? Recruitment phenomena. Beta, isko bhi yaad rakhna hai. In ENT, one is rollover phenomena, one is recruitment. What is rollover phenomena? Rollover phenomena is for neural deafness. याद करेंगे बेटा, it is for neural deafness. Rollover phenomena is for neural deafness. Recruitment phenomena is for sensory deafness. Rollover phenomena is a phenomena of fatigability. Recruitment is a phenomena of, tell me, oversensitivity. Is oversensitivity. Done. Coming to the next one, a child with a throat pain want to have a white membrane which bleed. If the membrane bleed, it will be diphtherial. It will be diphtherial. One of the student is asking, what is, kindly repeat vestibular. But a vestibular neuritis is like patient, a pediatric patient having a history of URTI, upper respiratory infection. Now he is having some vestibular symptoms. So it is self-limiting. Within few days to weeks, it will resolve of its own. What is the beauty of this word? Vestibular neuritis, vestibular nerve involved. So the word itself is telling you, okay, there is no hearing loss. There is no hearing loss. That now concentrate on the slide. Examiner is giving you the keyword, okay, the membrane bleed. If it doesn't bleed, it is streptococci. If it bleed, it is diphtheria. Now appreciate it. In streptococci, the membrane is localized on tonsil only. The white membrane will be on tonsil only. But in case of diphtherial, the membrane from the tonsil, it is extending to the palate. Can you appreciate it? This one, focus your eyes on this membrane of diphtheria. It is extending from the tonsil up to the palate. So if it is only on the tonsil, we call it as streptococcal. If it is extending to the palate, it is your diphtherial infection. Diphtherial. Done. Coming to the next one, again, this is a very favorite question for the last 2-3 years. Every examiner is asking you this MCQ. Examiner is showing you a endoscopic view. An examiner is asking you to identify the site of origin. Now you tell me, where is the site of origin? Tell me, any student? This is my ET tube. Behind ET tube, there is a bulge, that is torus tuberous, and behind that, there is a fossa of Rosenwald. I will be showing you the slide. Can you appreciate? If this is my ET tube, if I label this as ET tube, behind is torus tuberous, and behind torus tuberous, here will be my fossa of Rosenmuller, and this will be the most common site for your nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Is it clear? So just behind this will be a nasopharyngeal carcinoma. Is this concept clear? Fossa of Rosenmuller. Most anteriorly, सबसे आगे बेटा क्या दिख रहा है आपको? It is your ET tube, and most posteriorly will be your fossa of Rosenmuller. And what will be in between? In between will be your torus tuberous. In between will be a torus tuberous. Is it clear? Few important sites, beta. Just remember, they can ask you about nasopharyngeal carcinoma, that is fossa of Rosenmuller. They can ask you about angiofibroma. The most common site for angiofibroma. Anyone? Sphenopalatine foramen. They can ask you most common site for abscesses. Most common site, Litter's area. In abscesses, they will be asking you most common artery actually, that is sphenopalatine artery. So these areas are very important. Clear? Which is the narrowest part of larynx in pediatric patient, in adult. So just remember, in adult is glottic area. In peds, it is subglottic area. Subglottic area. They're very favorite MCQ of your examiner. So most common site and all these things should be on your tips. Coming to the next one. Patient with merciful anosmia. The keyword given by the examiner, merciful anosmia. बेटा किसकी बात चल रही है? We are talking about atrophic rhinitis. Merciful anosmia means patient himself is not aware of his foul smell. So merciful anosmia, roomy cavity. When there is everything is atrophied, it is roomy cavity. Most common symptom of atrophic rhinitis is here nasal obstruction. The third important point is a nasal obstruction. Clepsilla. It is associated with clepsilla. Just remember this concept. A foul smelling crust, clepsilla. They are common in these two conditions. These two keywords are common for either atrophic rhinitis or rhinoscleroma. Rhinoscleroma. Is it clear, beta? Now, what we'll be giving, we will be cleaning the nose with a alkaline solution. They can ask you the compound sodium bicarbonate, biborate, sodium chloride. All those are the important points. Hypertrophic rhinitis, they can give you the keyword mulberry-like mucosa. Everyone revise with me. Mulberry-like mucosa is equal to hypertrophic rhinitis. Mulberry-like polyp is equal to rhinospodiosis. Rhinospodiosis. Clear? Rhinitis medicamentosa, again a very important point, beta. FMGE examination, either they can ask you on polyps, like they can ask you Semster's triad, or they can ask you rhinitis medicamentosa. Very favorite topic. Clear? Beta, doctor's answer will be here atrophic rhinitis. In this MCQ will be atrophic rhinitis. Done. Now, rhinitis medicamentosa is overuse of any vasoconstrictor. If you are using a vasoconstrictor for a long period, so patient is a, when the patient stop the drug, when the patient stop the vasoconstrictor, there is a rebound phenomena. All the blood vessels will be dilated, and patient will be having excessive watery discharge. And what is the treatment? You tell me. What is the treatment for rhinitis medicamentosa? Topical steroids. We use topical steroids. Done. Hypertrophic rhinitis, mulberry-like mucosa. Atrophic rhinitis, already we have discussed. Rhinitis medicamentosa is a withdrawal phenomena. One, they can ask you for vasomotor. Vasomotor. What is vasomotor rhinitis? Vasomotor rhinitis is sympathetic tract comes down, parasympathetic go up. What we do? We dissect a nerve which is known as Vedian nerve. Vedian neurectomy. We dissect a nerve. Vedian. Done. So these are the important keywords, beta. In nasal cavity, your polyps, abscesses, rhinitis, they're very important topic. Clear? Coming to the last MCQ, 14-year-old boy, this keyword with abscesses. So beta, diagnosis going in the favor of angiofibroma. No history of trauma. Clear? क्वेश्चन नंबर 11 बेटा 3 सबसे पीछे जो है ना बेटा उसको कहेंगे हम, we will label it as fossa of Rosenmuller, most posteriorly. Clear? Is this clear? Now here it is your nasoangiofibroma, nasopharyngeal angiofibroma. The keyword abscesses, 14-year-old boy, most common site sphenopalatine foramen. Most common site is sphenopalatine foramen. What is contraindicated in this patient? They can ask you what is contraindicated. Yes, anyone who can write in the chat box. Angiofibroma patient, we never do biopsy or debulking. We never do biopsy or debulking because it is because the muscles fibers are not there in the walls of the blood vessel. It bleeds profusely. That was the MCQ. Why it bleed profusely? So just remember, because of the lack of the muscle fibers in the wall. Is it clear? Angiofibroma, expected frog face deformity. They can give you a frog face deformity, or they can show you Hallman-Miller sign. Can you appreciate beta? Posterior wall of maxillary sinus bending down. We use a word Hallman-Miller sign. Hallman-Miller sign. This is your frog face deformity. Frog face deformity. Done. Dissecting the other options. Nasopharyngeal carcinoma. They will mention the Chinese population. They can ask you the most common site. They can ask you virus, Epstein-Barr virus. As with Epstein-Barr virus, these are the keywords. What is the keyword for foreign body? Anyone who can write in the chat box, keyword for the foreign body, unilateral foul smelling discharge. Unilateral foul smelling discharge is the keyword for polyps and for foreign body. Enteroconal polyp against ethmoidal polyp. Very important topic, beta. Enteroconal polyp, always remember, is equal to unilateral polyps. Enteroconal polyps are unilateral. Enteroconal polyp are single. Enteroconal polyp are known as trilobe polyps. बेटा इनका क्या नाम होता है? Trilobe polyps. Ethmoidal polyps are bilateral polyps. They are multiple polyps. बेटा they are like grapes, grape-like polyps. Just remember important point for upcoming examination. Ethmoidal polyp reoccurrence is seen. Reoccurrence is a phenomena of ethmoidal polyp. There is no reoccurrence in enteroconal polyp. In enteroconal polyp, there is no reoccurrence, beta. No reoccurrence in enteroconal polyp. Is this concept clear? Done. So, nasopharyngeal carcinoma, angiofibroma, foreign body, enteroconal polyp, all these are the important keyword. One more point, beta. Nasopharyngeal carcinoma, age of distribution, bimodal. One peak is at 20, one peak at 60. It is bimodal distribution. Bimodal distribution. Done. So these are the important expected topics, MCQs for upcoming examination. Let's know two more MCQs are there. Which of the following is the abductor on the vocal cord? Just remember, with a golden rule, all muscles are supplied by recurrent laryngeal except cricothyroid, which is supplied by external branch. So beta, cricothyroid is a exception for nerve supply. All muscles are adductor except posterior cricoarytenoid is a abductor. Is it clear? Is this concept clear, beta? इसको नहीं भूलना आपने. All muscles supplied by recurrent except cricothyroid. Cricothyroid is the exception for nerve supply. This year I am expecting one MCQ on cricothyroid, which is the chief pitch changing muscle. आपका pitch कौन decide करता है? The main pitch changing muscle, deciding muscle is your cricothyroid. All are adductor except PCA, posterior cricoarytenoid is the abductor. Done. Now one more rule. This is my vocal cord. Area above the vocal cord is supplied by internal branch of superior nerve. Area below recurrent laryngeal nerve. Is this concept clear? All these are the important potential MCQ. Now out of these, which is the safety nerve? Just remember, internal branch is known as safety nerve of the larynx, while posterior cricoarytenoid is known as safety muscle of the larynx. Two important points: safety nerve of the larynx, safety muscle of the larynx. Safety nerve, internal branch of superior laryngeal nerve. Safety muscle, posterior cricoarytenoid. Posterior cricoarytenoid. Is this concept clear? Crystal clear. Then coming to the next one, 5-year-old child with a history of URTI is having some feature of mouth breathing, sleep apnea, nasal obstruction. It means the examiner is giving you some cause of ET2 blockage, that is adenoid. Mother have noticed that child increase the volume. Clear? That is here while watching the TV. What is the most appropriate treatment? So first of all, make a diagnosis. What is the diagnosis? You tell me. Diagnosis of the patient. Yes, diagnosis. Any student. It is serous otitis media. Serous otitis media with adenoid hypertrophy. Now serous otitis media, beta, I am dissecting this word, listen carefully. Only myringotomy, out. Grommet insertion, only out. Now question is, grommet insertion with adenoidectomy is a better choice, or myringotomy with grommet insertion is a better choice? You tell me. But when you are giving the grommet, when you are putting the grommet, obviously we are puncturing the tympanic membrane. Myringotomy word can be taken, granted. But adenoidectomy is a better option here. B option. But a B is better than C. I hope you are getting the concept. It will not be B. Here answer will not be C. B is a better option. Adenoidectomy with grommet insertion. Is it clear? These are the grommet which we place in antero-inferior part. This is cartwheel appearance. They can ask you in stage of pre-suppuration of CSM will get cartwheel appearance. Lighthouse sign is seen in stage of suppuration. Clear? If the disease is in the upper part, already we have cracked disease in the upper part, it is unsafe ear. That is, we have to go for MRM, modified radical mastectomy. If the disease in the lower part, I will be going for tympanoplasty with OCR. Is this clear? So these were the important points, beta. In the last spell, have believe in yourself. Even if beta is word ko samajhna, even if you have completed half of the subject at this point, don't quit the game. Work hard with the PYQ. अगर किसी सब्जेक्ट में आप वीक हैं, no worries, just do with the PYQ. Do anything except quitting the game at this point of time. Am I understandable? Clear? One important strong message on this platform. In your upcoming examination, beta, be normal, behave normal between, is it clear, beta? I want this promise from everybody. Everyone should write in the chat box, okay, we will behave normal between session 1, session 2. But I have seen many students who spoil their exam because they get excited after the first session. For the last few years, we are observing the session 1 is on, if you compare with the session 2, session 1 is on the easy side. So never get excited, beta. Never get excited. Behave normally in the break. And don't discuss any MCQ in the break. Before going for the session 2, you should not be discussing any MCQ, beta. अगर आपका सेशन 1 नहीं भी प्रॉपर हुआ, so just be confident, give your session 2 nicely. Am I understandable? Is it clear, beta? Believe in yourself. Best wishes. You can follow me on the Insta. You can inbox all the queries. Best wishes. And myself, Dr. Deepak, DAMS-eMedicoz faculty, waiting for you for your interview. And we are damn confident you will be definitely coming with the flying colors. Best wishes. Best wishes.